Hi, I'm Eliany Mejia, and this is Heart Rhythm TV, and we are here live covering all the EP science at ACC 2022. Today is a good day. We have an amazing afternoon packed with really good late-breaking trials, and today I want to get some reactions. Welcome, Pam, to Heart Rhythm TV one more time. I would like to start with FXIa. So tell me about your impression about this trial.
Yeah. So FXIa was one of the trials that I was most interested in seeing. As an electrophysiologist, obviously stroke risk with atrial fibrillation is a huge concern of mine, as is bleeding risk for our patients who need anticoagulation. And so any new option that has the potential to be safer and better for our patients is great. So the thing that's interesting about asundexian, which is the drug that's being studied, is that it's a factor 11A inhibitor rather than a factor 10A inhibitor. And the thinking is that, at least in sort of the in vitro animal models, it's really implicated in thrombogenesis, but not so much in hemostasis.
It's amazing, right?
Exactly. Right. So what we're hoping is that it's going to prevent strokes for our patients, but there's not going to be so much bleeding. Now, FXIa is, of course, a phase 2 trial, right? So it was only 12 weeks long, but they were looking at different doses of it and comparing it to Apixaban. And certainly preliminarily, it looks like it's not going to have potentially the bleeding risk, or at least it's as safe as Apixaban. So that's really exciting. And so we're really hopeful it's going to turn out to be a great drug for our patients in the future, but still early days.
It is early, but it's very promising, right? We're talking about once a day dose, right? We're talking about only 15% renal clearance. And are we thinking here that we are finally uncoupling the risk of thrombosis versus bleeding?
Yeah.
It's kind of
Well, that's what
amazing.
we're hoping, right? You know, but it's one of the things I can't help but think about is many of my patients aren't able to get DOACs, right? We've reached a point in the guidelines where the DOACs are actually favored over warfarin. We know that to be true. But many of my patients are still on warfarin because they can't afford it, right? And so, you know, one of my concerns when I was listening to the data is, you know, what will this practically mean for our patients? Even if it comes to fruition, which we all hope it does, our patients going to have access to this medication?
Yeah. Well, we just have to wait and stay tuned for the phase 3 trial. So thank you so much, Pam, to be here with us at Heart Rhythm TV. Thank you so much.